This is episode 696 of the Rio Grande Foundation's Tipping Point, New Mexico. I'm Paul Gessing, president of the Rio Grande Foundation, New Mexico's free market think tank. You can find out more about the foundation at riograndefoundation.org. I'm very pleased to be joined by Michael Cannon. He is the Cato Institute's Director of Health Policy Studies. And I've known Mr. Cannon for more than 20 years, I believe now, although it's lost to the sands of time as to exactly when we met, but I believe it was in Washington, D.C. before I moved to New Mexico and got rolling with the Rio Grande Foundation. But welcome to Tipping Point, New Mexico, Michael.
Thanks for having me.
Well, I'll just jump right into it. The healthcare provider shortage in New Mexico was one of the, at least looming issues of this legislative session. But like so many aspects of New Mexico's legislature, they didn't do much to actually address the problem. Now, we're going to talk at both the state level and the federal level in this conversation. But if you had the ability to get New Mexico's legislators in a room and tell them, either gently or more aggressively, reading them the Riot Act, what would you tell them about New Mexico's health provider shortage and broadly about healthcare policy in the state of New Mexico?
That they're going about solving that problem and the problem of access to care in totally the wrong way, in almost every respect. Now, I'll say this for New Mexico, relative to other states, it doesn't appear that New Mexico imposes as many regulations on mid-level clinicians, nurse practitioners, clinical psychologists, physician assistants, and so forth, that as other states do. Other states are far more regulatory, but that doesn't mean that New Mexico is in a good place, because New Mexico still doesn't recognize clinician licenses from all other 50 states. It needs to do that if it wants to make it easier for clinicians to come here and provide lower cost, high quality care to everyone in New Mexico, but particularly those with low incomes, vulnerable patients.
Are you referring to now? Cato, of course, is a libertarian organization, so broadly speaking, in line with a lot of what Rio Grande Foundation is all about. Now, you refer to basically occupational licensure as a
Right.
general concept. Now, I know libertarians are skeptical of occupational licensure as a general rule. Are you referring to the compact concept that a lot of states are a part of? Because there was, I don't know, probably close to 10 bills in the legislature that would have added New Mexico into some of these interstate compacts. Is that an acceptable second best option relative to just get rid of occupational licensure and let some private entity handle it? Or what is your vision in that regard?
From my perspective, the only acceptable outcome is when the government recognizes your right to choose your clinicians, your right to choose your doctors, your nurses, and so forth, because that is a fundamental human right. And when the government says, no, this nurse practitioner can't practice in this state because they didn't get a piece of paper from the state, or this cancer specialist can't see New Mexico patients via telemedicine because they didn't get a piece of paper from the state of New Mexico, then what the government is doing is it's violating your right to choose your own provider. And so that's the only acceptable outcome. As for steps in that direction, is a compact a step in that direction? I can't really tell you, because compact doesn't mean anything. It doesn't really tell us anything about the substance of the agreements that states are making with each other. There are some compacts that don't do anything to restore your right to choose your clinicians, and other compacts do. There's a nursing licensure compact that goes much farther than say the one for physicians. But compacts aside, never mind compacts, what the states should be doing is first best option, of course, would be to eliminate occupational licensing for the health professions. It hasn't improved quality. It increases prices. It actually reduces quality, I would argue. And if you got rid of it today, just about zero patient protections would disappear, but healthcare would become much more affordable and also, I would argue, higher quality. Next, a second best option, rather than compacts, would be for the state of New Mexico to say, hey, look, if you have a license from any other state, you can come and practice in New Mexico. So you don't have to go through the rigmarole of getting a license from the state of New Mexico, and you don't even have to leave home, because if you have a license from another state, such a law would allow you to see New Mexican patients via telemedicine, via telehealth over the internet, without having to travel. So that right now, patients can travel out of state to see top specialists around the country, but the government prohibits those specialists from providing telehealth consultations, erecting what is essentially a virtual wall around the state. And full recognition of other states' licenses would eliminate that wall. So that, I think, would be the second best option. And compacts are good to the extent they resemble unilateral recognition of other states' licenses, but most do not.
Fair enough. All right. So I know we're going to talk about Medicaid fairly extensively, and that has obviously a federal state nexus. Other concepts that you think states like New Mexico that are struggling to keep doctors in, obviously occupational licensing, one of them, I'll just throw it out there. Rio Grande Foundation is, especially given New Mexico's financial position, where we've rocketed up in terms of oil production. Our budget picture is very strong. Thus, the Medicaid Trust Fund. We'll talk about that in a few minutes. But I know it's kind of obvious and very libertarian, which is eliminating personal income taxes, those kinds of things. I mean, I realize you may not have data, because it seems kind of obvious that doctors want lower taxes like everybody else wants lower taxes. But would you recommend that? Are there other areas that you think states like New Mexico should be considering addressing that maybe aren't on the radar screen, that are kind of off to the side?
Oh, absolutely. So almost half of New Mexico's population enrolls in the Medicaid program. That's where they get their health insurance. And for some areas of medical practice, Medicaid is the number one buyer for those services. So then that means that a lot of the decisions that providers are making about whether they're going to come to the state, whether they're going to stay in the state, depend on how much the Medicaid program is paying. And if it's not paying enough, then the cost benefit calculus is going to make coming or staying here infeasible, unattractive. And the worst part is that those prices aren't flexible like market prices are. So they can't really signal, they can't rise to signal a shortage and draw more supply into the state. They're just going to stay where the politicians want those prices to be. And so there are studies that suggest that the prices that Medicaid pays in New Mexico for many physicians are very low. And if that's half of the population, then that is going to make it very hard to attract providers to the state. It's you could say one solution is we'll just spend more, and it's hard to imagine New Mexico spending more on the Medicaid program. But I suppose you could. But the problem there is it would increase increase the burden of the program on folks in the state. It would increase taxes for those providers that you want to draw into the state. It would also increase taxes for the low-income people who you want to be able to climb the economic ladder so they're not dependent on Medicaid anymore. And this is something we talked about at the Rio Grande Foundation event last night. If New Mexico is already helping the federal government hurdle toward a Greek-style debt crisis by increasing federal Medicaid spending as much as the state of New Mexico possibly can, and not putting the state's own money toward providing health care to the poor, that Medicaid trust fund and all of that money in that sovereign wealth fund, that's all money the state could be spending on its own to provide medical care to people, but it's not. It's drawing down federal funds and therefore helping to exacerbate the federal budgetary picture, and push us closer and closer to the date where bondholders finally say to Congress, we don't think you're going to pay off these bonds. And they stop lending money to Congress, and then there are going to be massive cuts to the Medicaid program when that happens, which is really going to jeopardize access to care for low-income New Mexicans.
All right. Well, clearly, Medicaid is at the top of the agenda here when it comes to it's being such a dominant player in New Mexico and its healthcare marketplace. So before we get into the specifics, why don't you just describe the way Medicaid works in general, and more specifically, especially in New Mexico, given our inflated rates of return on the Medicaid program?
Sure. So the Medicaid program, people often confuse it with Medicare. Medicare is for the elderly. Medicaid is ostensibly for low income people. There are a lot of high income people on the program, and uh, and it's different from the Medicare program in that the federal government doesn't operate it the way the federal government operates Medicare. What the federal government does with Medicaid is it gives a bunch of money to states so that states can operate their own Medicaid programs. And you might think, oh, well, Congress gives money to states, and then that helps. And uh, but the way that Congress makes states the offer of federal funds is is really economically it creates a lot of perverse incentives. It's economically dangerous. It is um, and it's really harmful to the health sector and to enrollees in the Medicaid program, low income people, and people even outside of the Medicaid program because of the uh, higher tax burdens that it creates and so forth. So the way that works is the federal government says to states, "Hey, you know what? If you implement one of these Medicaid programs and you spend a dollar on your Medicaid program, for every dollar you spend, we will match that with a federal dollar." And in that's for high income states. If you're a low income state like New Mexico, then when you spend a dollar on the Medicaid program, we give you $3 from the federal government. So states can double or triple or quadruple their money by devoting more money to the Medicaid program. So this creates all sorts of problems. It means states are going to divert funds away from education and roads and police and so forth to Medicaid because when they spend a dollar on Medicaid, especially in New Mexico, they end up with four. They can by imposing $1 of political pain, raising $1 in taxes, they can give out $4 of political benefit. And so they do divert money from other priorities. They do raise taxes, including on low income people, in because if you raise a state income tax by 1 percentage point to fund the Medicaid program, it's like raising it by 4 percentage points if you're New Mexico. And so that encourages states to expand their Medicaid programs, to enroll more and more people. That's how New Mexico got to the point where 47% of the population enroll in the Medicaid program. And the federal government makes that deal even more, or provides even more federal funds for the Obamacare Medicaid expansion. Now, the old Medicaid program was who you might think of as the most vulnerable low income people, the elderly, blind, disabled, pregnant women, children. But Obamacare came along and said, hey, you know what? We're going to expand the Medicaid program to all adults below 38% of the federal poverty line. That's around $18,000 or so per year or something. And that basically meant that it expanded Medicaid to everyone who wasn't already eligible, and that group is basically able-bodied childless adults. And for those folks, if a state implements that Medicaid expansion, then for every dollar the state puts toward those folks, the federal government gives them $9. So they can increase their initial investment by an order of magnitude by spending more money on providing Medicaid to able-bodied childless adults, and so after year after year, state legislators face this incentive, and that's why the Medicaid program has grown so rapidly, not just over the decades, but just in the past 4 years. I mean, over the past 4 years, the federal government's estimates of how much Medicaid is going to cost each year have gone up by about $60 billion. So, and it largely because of this huge incentive that the federal law creates for states to just throw more and more money at Medicaid, and then it also breeds. So it creates a lot of it leads to higher government spending, higher taxes, a lot more dependence on government because more people enroll in the program. It creates a low wage trap for tens of millions of Medicaid enrollees because if they climb the economic ladder, they lose this valuable benefit, which creates a disincentive for them to try to improve their lot in life. And it also makes it harder for people outside of Medicaid to afford medical care because the Medicaid program has spillover effects that increase the prices for private healthcare and health insurance. So that's basically how the Medicaid program works, how the relationship between the federal government and states work, and why it is um, so economically perilous and expensive, and why it's contributing to the national debt, and why Congress has to change it.
So a lot to unpack there and discuss, but one of the things that was, while you're talking about restraint and this needs to be reformed, New Mexico's legislature seriously considered a bill and likely would have taken it more seriously this session had Joe Biden or Kamala Harris, for example, been in office. That would have expanded New Mexico's Medicaid program to even higher income levels. I gather that is not a idea that you think makes a lot of sense. What are the issues with that? Obviously, the budgetary ones, but talk more about how Medicaid and the very large Medicaid population we have in New Mexico impacts them as well as the system as a whole.
So on the one hand, you kind of feel for the state legislature and the legislatures in all 50 states, because the deal that Congress is offering them is so remunerative that, I mean, you had a think tank, Paul, the Rio Grande Foundation.
Yes.
Imagine one of your donors said to you, "Hey, you know what, Paul? For every dollar you raise and spend on something, I'll match it with $9 other dollars." Not only would you go crazy trying to expand that program, whatever program that was of the Rio Grande Foundation, to the exclusion of maybe even more productive programs, but you would just keep on spending and keep on spending, and you might even do some of what the state of New Mexico has done. You might tell that donor, "Hey, I raised $1. Can you give me that matching $9 you promised?" When really you didn't raise that dollar at all. You could get another donor to give you $1, and then you could give that dollar back to them once you pull that money down. So there, with incentives like that, you can see why the state just wants to expand the Medicaid program all the way up to people making more than $100,000 per year. Why they are running these really scams, like the one I just described between you and your matching grant donor, and your hypothetical matching grant donor, and
yeah, please tell me if you have one of those. I'm glad.
Yeah, I would never divulge.
Any listeners out there want to participate in that particular scam, we're also happy to accommodate.
And President Joe Biden himself former President Biden called these things that states do to pull down federal funds a scam, and Congress can't get rid of them because the main beneficiaries, the main constituent of the Medicaid program is not Medicaid enrollees. It is not the high cost, low quality providers that the Medicaid program is saving from going out of business because it's subsidizing them like crazy. Markets would get rid of these high cost, low quality providers and free up those resources for other people to offer patients a better job. That's not happening because the Medicaid program is subsidizing them. They're not even the main constituency of the Medicaid program. The main constituency and beneficiary of the Medicaid program is state legislators and governors who gain office and remain in office because they're able to pass out all of these goodies while dumping more debt onto future generations. And so what the New Mexico legislature is doing, the legislature should be ashamed of itself. Not just that it's considering expanding the Medicaid program up to people making more than $100,000 per year, but that it has expanded the Medicaid program as much as it has already. That it has that money set aside in a sovereign wealth fund, and it's creating this $2 billion Medicaid trust fund. But it has the money to pay for these things itself, and still it is pushing the federal government closer to a Greek-style debt crisis that will jeopardize access to care for all of those people that the legislature has enrolled in the Medicaid program. And they don't care. Their attitude is laissez le bon temps rouler. Just let the good times roll as long as all that federal money is coming, and and let the future worry about the future. This is one of the many, many reasons why you don't want to trust your healthcare or your long-term planning to government, because it creates such massive incentives for irresponsible behavior.
Yeah, let's briefly talk about that. New Mexico is flush with cash. It's something that the Rio Grande Foundation talks about quite a bit. We would love to see that money return to the taxpayers of New Mexico to help diversify our economy. The oil and gas industry is driving it. This session, there was a bill that passed, I believe, both houses. I want to say HB 88, offhand, maybe SB 88. I forget which side, but it sets up a trust fund to pay for Medicaid. Now, the governor and some policymakers say, well, the federal administration may cut Medicaid. They're not even talking about doing what you and I think they should do, which is to block grant Medicaid. But why in the world, in my opinion, and probably yours as well, would policymakers set up a trust fund to pay for Medicaid when they could or should be doing things with that money to actually reduce poverty and improve outcomes in New Mexico to begin with? So it's shameful. Unfortunately, Republicans in the Senate, at least, voted for this unanimously, as did Democrats.
So two issues here. One is what the state of New Mexico should be doing with those windfall tax revenues. And the other question is what Congress should be doing about the Medicaid program. So you get windfall tax revenues like that, and it's a dangerous situation because it just gives the politicians a lot more power. The voters were already telling the politicians how much government they wanted. The imperfect political process. They had some idea of how much government they wanted, and then it's as if when you get a windfall increase in tax revenue like that, it just channels a bunch of cash to the legislature that voters didn't really. Maybe the taxes were in place, or maybe they imposed them as a result of this, but it just gives the legislature a lot more control over the economy and a lot more power that they should be laying down. They should be returning all of that that windfall to the people, and you could do it by reducing the taxes that gave rise to the windfall revenue, or you could reduce other taxes, income taxes, sales taxes, etc. Just so the federal or the state government is not controlling that sector of the economy, not deciding what industries are going to emerge as a result of this economic growth in the state, and that would be a more viable, sustainable way to use those resources, to leave them in private hands so that people can adjust and stop investing that money in things that aren't providing value and direct them to things that are. If the state controls it, they're just going to be sending money at things that aren't providing people value, like expanding the Medicaid program, and it's going to be hard to redirect those resources to ways that are going to improve people's lives. So they absolutely should not be building up, certainly not a fund as large as the one they have. I think you said it was $61 billion.
$61 billion.
And that they should be devoting that or using that to reduce taxes. As for what the Congress should be doing with the Medicaid program, Congress bears some of the blame here as well, because Congress, through the Medicaid program, is creating an incentive for states to hold on to every penny they have or they can get, so that they can devote it to Medicaid and get and double, triple, quadruple their money or increase it tenfold. And with the $2 billion, I mean, maybe because I'm a health policy wonk, but the most offensive part might be the $2 billion they're setting aside for this so-called Medicaid trust fund. And that's offensive to me because one of the stated purposes of this trust fund is they want to have some money set aside in case the federal government does cut Medicaid spending. And I want to be clear, the federal government is not talking about cutting Medicaid spending. No one is talking about cutting Medicaid spending. Everyone is saying that that's what the federal government is doing, but there are no viable proposals in Congress to do that. The one that everyone is talking about, the House Republicans' budget proposal, It says that it wants to reduce the growth rate of Medicaid spending from 6% per year to 3%. That is not a cut. And yet everyone's pretending that it is. And so New Mexico is putting this money aside in case the federal government doesn't spend as much money as they would like so that they can replace it with some state money. But if they have that much state money, they shouldn't be pulling down federal money in the first place. If they have money that they can set aside to replace any money the federal government cuts, well, then they shouldn't be complaining about federal cuts because they have the money to absorb that. And yet Medicaid advocates in the state of New Mexico are still agitating against even reducing the rate of growth of federal Medicaid spending, and making it much harder for Congress to avert the sort of debt crisis that could really jeopardize access to care for Medicaid patients.
And we may come back to block granting in a minute, but something that New Mexico struggles with, again, that crosses over from the healthcare issue to more social problems and economic issues, is our low workforce participation rate. From your comments at our events and just in general, I gather that Medicaid does impact negatively the desire, the ability for people to work in gainful employment, to go up the income scale. Can you just briefly describe the kind of impact or dichotomy between Medicaid and workforce participation and labor
Sure.
rates?
Sure. So there are lots of things that affect workforce participation. While one of them is, age as a society, ages, workforce participation is going to go down. Another is the state of the economy. If there aren't jobs out there, then people think there are, then they won't search for jobs. But also, there's a whole raft of policies that affect workforce participation. Everything from tax policy to not just means tested or income tested welfare benefits, but all benefits from government. So to the extent the government is providing people valuable benefits and they don't have to work to maintain their standard of living, they're going to have less incentive to work, and that is going to reduce workforce participation. And Medicaid is a contributor to that because Medicaid does spend thousands of dollars per enrollee. Not every enrollee gets thousands of dollars of benefit. Many don't get much benefit at all, but many get many thousands of dollars worth of benefit from the program, and they have a disincentive to join the labor force or to work more. We're talking about workforce participation, so that creates a disincentive for people to join the labor force, even though, to be clear, many Medicaid enrollees do work. It can still have an effect by keeping some people from entering the labor force.
All right, and kind of a not random question, but you mentioned earlier ways that states like New Mexico scam the federal government or the Medicaid program, and not this year, but in 2024's legislative session, a bill passed, the Healthcare Delivery and Access Act, which I'll just briefly read from an Albuquerque Journal article. It will help hospitals by allowing the state to assess a larger tax on big hospitals, pool it, leverage those funds for a federal Medicaid match, then bring about $1.5 billion with the B in total funding back to New Mexico to reimburse rural hospitals. Specifically, rural hospitals pay only 19% of the assessment and receive over 40% of the new funding. But basically, this is a scam perpetrated by the legislature of New Mexico to try to fleece taxpayers in other states out of $1.5 billion. Not chump change.
And the hospitals. I mean, don't forget the hospitals are part of this scam.
True.
And the way it works is I described the matching grant system the federal government offers. And if the legislature is reluctant to put that $1 forward to pull down those $3 federal dollars or the $9 federal dollars, then they can go to the hospitals, or the hospitals can go to the legislature and say, "Hey, let's do this. You the legislature gives the hospital $1. That triggers $3 or $9 of federal funds. So that money goes from the federal government to the state. And then the state says, hey, you know what? Hospital, I'm going to tax you now. And we're going to take back that initial dollar, put it in general revenue, whatever. We're going to spend it on other things. That, what they call provider tax, it effectively means that the state isn't putting any money forward to pull down the 3 or the 9 federal dollars. It is a scam. It's a shell game. They're just moving the shells around so fast you can't see where the ball is. But and this is the thing that Joe Biden himself called a scam, these sorts of provider taxes. You can tell that it's not a tax, not really a tax, because the hospitals are happy to pay it. They're happy to pay it because they know that it's going to bring so much money into the Medicaid program that they're not going to be net payers. They're going to be net recipients under this scam. And that's why sometimes the legislatures go to the hospitals with these ideas. Sometimes the hospitals take these ideas to the legislatures. It's all about gaming the system so they can pull down as much federal money as they can and send the federal government closer and closer to a debt crisis.
All right. Well, that's frustrating and difficult stuff. So we mentioned what's happening in Washington, and on one hand, you're kind of reassuring the worrywarts here in New Mexico about, well, nobody's talking about cutting Medicaid, and I agree.
Unfortunately, they should be, but they're not.
Right.
It's very disappointing.
We agree on that. The legislature, the governor, they're ready to call a special session and throw the chairs out the window if actually cuts were made. But as I understand it relative to Medicaid, and this program, by the way, is estimated to spend $15.5 billion this year alone in New Mexico. Well, in the fiscal year that was just adopted, so starting in July, on July 1, $15.5 billion, which is in excess of our general funds, which is 10.8 by about a third. And obviously that's not something that's sustainable, and there's all kinds of problems. But now we're going to move this conversation fully over to the federal side of things, and we're going to put on Congressman Michael Cannon or President Cannon here. There's a Congress building with your name on it.
There's a Speaker of the House named Joe Cannon.
Yeah. But say you're that guy in the modern era. What do you do with Medicaid? What are the reforms that you're trying to push to the Medicaid program?
So the most important thing to know about the Medicaid program is that it should not exist at all. It is unconstitutional. It is corrosive of federalism. It is economically unwise. It violates your right to make your own health and other decisions. It exists to try to remedy medical deprivation that the government itself creates and should stop creating rather than create a Medicaid program. But it also adds to that problem of deprivation, as I mentioned, because it increases prices for private healthcare. So what Congress should do is it should eliminate the Medicaid program. And if all that funding is valuable, states can raise taxes. If voters want it, states can raise taxes to replace all of that funding. But that's not in the political cards right now. That's not politically feasible. And so I think the best politically feasible option would be if Congress were to block grant the Medicaid program, which is the same reform they enacted in 1996 for cash assistance welfare, federal grants to states. They gave states a fixed amount of money instead of this open-ended incentive to spend more and more federal money. They gave each state a fixed amount of money that they could spend for a broad range of purposes. I wouldn't put any restrictions on the money. I'd just give them the money and let states figure out the best way to provide healthcare to low-income people in that state. And that would end so much of the corruption and end so much of the perverse incentives, eliminate so much waste and fraud in the Medicaid program, give us a much leaner program that really did target funds toward the neediest residents of New Mexico and other states, and threw out of the program all of the well-to-do families that are using Medicaid's long-term care benefit, to provide long-term care service, nursing home and other long-term care services to people who could pay for it themselves. And so I think that would be like welfare reform was a tremendous success when it block granted cash assistance to states. I think that block granting Medicaid, federal Medicaid funding to states would also be a great success. And it's something that passed Congress. The original welfare reform bill had Medicaid block grants in it. President Clinton vetoed that. He should not have. But once they took that out, he signed block grants for other welfare. And so Congress should resurrect that idea, pass that bill, and we would get much lower cost, higher quality healthcare, and more affordable, sustainable, targeted assistance for low income people than we're getting right now.
Excellent. Well, we're going to, broadly speaking, leave things there, but how can people find out more about your work? I know you have two books. One is Healthy Competition. It's several years old, and recently you wrote Recovery, a guide to reforming the U.S. healthcare sector. That was in 2023, if I'm not mistaken.
That's right.
So
that's right. And so you can get both of those on Amazon or on the Cato website. That's cato.org, cato.org. And you can follow all Cato Health Scholars on, on Twitter, what people are now calling X, at Cato Health, Cato Health. I'm also on that, the Twitters and most of the other socials at MF Cannon. And so you can find me and follow my work there.
All right. Well, thank you for coming to New Mexico and sharing this information and knowledge. Very much hot on the heels of the 2025 legislative session, which we would like to have seen, and many others would like to have seen some more done to address the medical provider issues in the system in general. But unfortunately, it was not done. So hopefully people will check out your books and or writing materials there on the Cato website. And with that, thanks for listening to this week's episode. Find all episodes at tippingpointsnm.com or at the Rio Grande Foundation's YouTube channel. Subscribe to the show at Apple, Stitcher, or tell Google Home to play Tipping Point New Mexico. Thanks to Path 3 Marketing for producing this show.